Our study is called Food as Medicine. It is a produce prescription program that's funded by USDA. And really we're trying to aim in reducing food insecurity, increase fruit and vegetable consumption, and improve health outcomes.
A produce prescription program is exactly what it sounds like, subbing out pills and medications for apples and carrots. This allows researchers to look closer at the role those fresh fruits and veggies have on chronic conditions like diabetes, cardiovascular disease, high blood pressure, and obesity, specifically by removing the financial and logistical obstacles that keep people from getting healthy meals on the table.
This study in particular is aiming to identify whether or not the mode at which we deliver a prescription matters. So half of our participants, about 200 participants, will be randomized to what we call a traditional in-store voucher method. And then the other 200 participants will be randomized to a produce box delivery.
One of those participants is Lauren Bowman, who's been getting weekly home deliveries for the past 3 months.
It's just changed how I've eaten more than what I thought it would. So it's been really cool. And again, it's like getting a present every week because you don't ever know what's going to be in your box. So it's like a gift. I actually get excited. So every Friday mine comes, I'm like, what did I get this week? So yeah, I'm going to miss it when it's done actually.
For Lauren, those weekly presents have already made a lasting impact on her health.
I have struggled with anorexia most of my adult life, and honestly, because I don't have much money, it's actually been hard for me to recover at times because I literally can't afford the food. But this has just really been a blessing for me because it takes that stress away that I can focus on my recovery and getting enough nutrition and the things that I need. I actually feel like I can eat more now than before because even just that extra $25 a week, $100 a month, for somebody that's on a fixed income, that's a lot.
Recently over the last couple years, as inflation increases and food prices increase, we're really trying to provide that incentive to be able to make that healthier choice and make that food environment easier for people to make healthier choices.
Each participant is enrolled for a period of 6 months, where their health is monitored and checked at the Vera Research Institute. The study will run through 2025 and garner important data for state and local leaders to potentially influence positive change on community health across our region.
Yeah, it's been really beneficial, and I think it would be super helpful for other people that are also in the same situation that I am.
If we can better understand if the method of how these programs are delivered, then we can kind of make sure that we're implementing the right type of program in communities to see the best outcomes.